If you have type 1 diabetes and you're without insulin, well, you've roughly 1 week to live. Sadly, Alec Rayshon Smith found this out in the worst of ways. At 26, the father of one from Richfield, Minnesota, found himself, in spite of his best efforts to locate an affordable plan on the healthcare exchange, without insurance. Unable to afford the $1,300 for his medication, he decided to ration what he had left until he was paid. On June 25th, during dinner with his girlfriend, he complained of stomach pain. On June 26th, he called in sick to work. On June 27th, he was found dead in his apartment. Insulin has been on the market since 1923, yet remains unaffordable. And unfortunately, stories such as Smith's, which appeared in the Harvard Political Review on January 22nd, 2018, aren't unique. In fact, the American Diabetes Association reported on May 8th, 2018, that insulin rationing is increasingly common among patients struggling to afford their medicine. And the problem doesn't stop with insulin. A group of concerned lawyers and scientists, known as the Initiative for Medicines, Access, and Knowledge, or the IMAK, reported on August 2nd, 2018, that on average, the price of branded pharmaceuticals has increased by 68% since 2012, with certain drugs, such as the fibromyalgia treatment Lyrica, seeing increases as high as 163%. Rising prescription drug costs are impeding patient access to life-saving medicines, and we're paying staggering financial and human prices for this. Today we're going to explore exactly how staggering. I'll walk you through why the increasingly exorbitant cost of prescription medicine here in the US is unsustainable. Then I'll explain to you the cause of the problem. And finally, I'll propose promising solutions that will leave innovation of future cures undisturbed, but at the same time, and most importantly, ensure patients can access the care that they need. To further understand the ethical problems our current system poses, let's consider the case of Trevor Fultz. He's a 10-year-old boy from Newport, Rhode Island, and an interview with his family published by CNN on June 22nd, 2018, chronicles their years-long struggle with his diagnosis of infantile spasms and their fight to obtain a drug called Acthar. Acthar is considered the gold standard of treatment for Trevor's disorder. Physicians claim it's effective roughly half the time. The manufacturer claims an efficacy of nearly 90%. It is also $40,000 a vial. Far from the already enormous average increase of 68%, Acthar has seen a price increase of nearly 100,000% since 2001. As you can well imagine, the Fultz's insurance company wasn't eager to pay for the baby's treatment. $125,000. Now, time is of the essence in addressing infantile spasms. If they're left untreated, they cause debilitating cognitive impairment, namely an IQ in the range of 30 to 50. So while insurance companies, pharmacy benefit managers, and drug manufacturers bicker over the list price, the patient edges closer and closer to a lifetime of disability. Trevor's mother Danielle said it best. When your infant's body is being racked by 40 seizures every single day, you do not have 3 business days to play Russian roulette, waiting for a medication that could stop his seizures and right your world again. And apart from humanitarian concerns, the pricing of specialty drugs can nearly bankrupt small cities. On May 6, 2018, CBS News reported that Rockford, Illinois exhausted its healthcare budget to purchase Acthar for 2 children with infantile spasms. Amazingly, Acthar was not always so expensive. There was a time when it cost only $40 per dose. But its manufacturer purchased its main competitor, Synacthon, sold in Europe and Canada for $33 per dose, and removed it from sale. It cost them $100 million, but allowed them to corner the market and demand whatever they wanted for their life-saving drug. Every company can make profits, but this is profiteering, said Rockford Mayor Larry Morrissey in 2018. But it isn't just the city, the insurance company, or the patient that foots the bill. We do too, because on April 26, 2017, the Brookings Institute reported that Medicare spends over $300 billion per year on prescription medicine alone. A more in-depth study conducted by Harvard professors Richard Frank and Richard Zeckhauser in January 2018 pointed out that nearly 1/4 of this expenditure comes from a very small class of drugs. Those priced like Acthar that are sold off-label to the elderly for a variety of maladies. On June 23, 2017, Business Insider pointed out that this is often done without any real understanding of its efficacy for off-label uses. Remember, Acthar is designed to treat one specific condition in babies. There's very little clinical data on its viability otherwise. Now, we can't stop doctors from prescribing off-label, and frankly, sometimes it is something they need to do. But what we can do is lower the cost of the drugs. So the question then becomes, how? Because sadly, much as we may wish it, the goal can't be to simply slash prices without regard to the effect this will have on innovation of new cures. The solution we arrive at needs to ensure the profitability necessary to fund research, but above all else, the accessibility necessary to save lives. And as simple as it seems, generics are the answer. On August 5th, 2018, the American Journal of Managed Care pointed out that generics save our country $250 billion per year already. The key is to expand them, but we need first to understand the tactics pharmaceutical manufacturers use to delay or even prevent generics from coming to market, because there are practices in the drug industry that simply do not hold up to scrutiny, and it is here that we may find our best angle of attack. On April 6th, 2017, the Harvard Business Review outlined a number of tactics pharmaceutical manufacturers use to maintain a stranglehold on a given treatment. According to the Drug Price Competition and Patent Term Restoration Act of 1984, upon inventing a new therapy, the company responsible is to be granted a patent and several years of monopoly over the market to capitalize on its invention. You see, the idea here is incentivize innovation, but in time allow competition to lower prices to a more accessible level. Unfortunately, this is no longer what happens. Now a number of drug companies simply bribe their competitors to hold off on the production of generics. It's a strategy they call a pay-for-delay agreement. And in February 2018, the Pharmacy Times estimated that these agreements cost us as consumers an estimated $98 billion, are responsible for an average 5-year delay in generic entry to the market, and are responsible for the delay of at least 140 generic products since 2005. And that's only one strategy. A second is for companies to simply rename their own products and sell them as something called authorized generics. This exploits a law whereby the first company to bring a generic to market gets 6 months of exclusivity. So without even having to file for a patent, companies can extend their monopolies by half a year. A third strategy is for a company to make incremental changes of, frankly, negligible significance in its products and submit new patents. This is exactly what Pfizer did with Lyrica, and it was successful in preventing the price of its flagship drug from lowering for 2 decades. Had generics actually hit the market when they should have, the aforementioned report by the IMAK estimates Lyrica could have dropped in price anywhere from 70 to 90%. So, now that we understand the problem and its causes, let's turn to what we can do. Because this is a reversible issue. It is one that can be solved in such a way that both producer and consumer can thrive. And on June 19, 2018, the Pew Research Center advanced a policy proposal banning reverse payment agreements, the so-called pay for delay. A similar bill died quietly in Congress in 2012, but with the Affordable Care Act struggling, the time is right for such an initiative now. A bill that attempts to rectify the problem is currently in the Senate. Senate Bill 124, the Preserve Access to Affordable Generics Act, authorizes the Federal Trade Commission to initiate proceedings against agreements thought to hamper generic entry to the market. This is an excellent first step and should be supported. Consensus is a precious commodity in our country right now, but we have it on the issue of drug pricing. Both Republicans and Democrats are open to incremental changes that will lower the cost of healthcare here in the U.S. And that is why, though I know you have heard this before, I'm asking you to write to your legislators to voice support for Senate Bill 124 and to ask for comprehensive generic regulation that will right at least some of the wrongs of the market system. If you or someone you know suffers from type 1 diabetes or has a child with infantile spasms or any one or more of the disorders whose treatments grow more expensive by the day, let your representatives know. Tell them you want a ban on pay-for-delay agreements and protection for generic drug manufacturers. The solution here is simple. We need only to seal the loopholes that are allowing this to happen. Because there is no reason someone like Alec Rayshon Smith should have died in his mid-20s of an eminently treatable sickness just because reasonably priced medicine was unavailable. His death is a symptom of a diseased system, one it is long past time we treated.